Bowel cancer screening is important because um, the test for bowel screening tries to identify cancer before it is symptomatic. It is generally accepted that if you can pick up a cancer before it is symptomatic, then the chances of treating that cancer successfully and curing the cancer are very high. Even more important for bowel screening is you want to try and identify growths in the bowel that are precancerous or pre-malignant, because if you can identify something that's pre-malignant and deal with it at that phase, then you can stop the patient developing a cancer. In simplest terms, growths in the bowel, pre-malignant or precancerous growths, and also cancerous growths, tend to bleed. So the test for bowel screening is a very sensitive immunochemical test that measures the hemoglobin in your bowel motions. And if you have enough hemoglobin beyond a cutoff, then your test comes back as positive, and that then triggers the health board or whoever's done the test to refer you on to have your bowel examined with a colonoscopy, typically. The things that we tell patients are watch out for a change in bowel habit, particularly one that's sustained and cannot be explained by anything else. So your bowel habit changes for several weeks and doesn't go back to normal for you, then that's important, particularly if you become looser with your bowel motions. Watch out. So unexplained or diarrhea that is new and persistent and doesn't resolve to normal or looser bowel motions. Also bleeding from the bottom, that is, if you, for example, have had bleeding from hemorrhoids or piles and the bleeding is different, it's darker, is mixed with the bowel motions, then these are the things that are alarming. In particular, what's very, very useful for us now with regards to dealing with bowel cancer and bowel issues is the Q-fit poo sample to check for bleeding into the bowels. GPs are now primed to check that for any change in bowel habit, etc. So if you have a Q-fit sample done and that confirms there's blood in your bowel motions that shouldn't be there, then that's a trigger for your GP to refer you. So if your bowel habit is changed and sustained, then you should see a doctor, particularly if it's changed towards looser bowel motions. If you have bleeding in your bottom that's through your bowels that's new, then you should let someone know, particularly if it's blood mixed through the bowel motions that isn't coming from hemorrhoids. Bowel cancer is the fourth most common cancer in Scotland. The numbers vary year to year, but they're thereabouts. Um, in terms of people being more prone to it, we know that there are some bowel cancers that are genetic, as in it runs in families, but these are clusters and they're rare across the actual total number of patients who have bowel cancer in Scotland. We do know that if that runs in various generations, then it's more common. But by and large, the vast majority of people who have bowel cancer will not have had a genetic uh, tendency towards it in their family.